why stomach cancer can be hard to stage accurately, what to know about challenging types of pancreatic lesions, and questions pathologists wish patients would ask about their pathology results. Joining us this morning, we have Dr. Marie Robert, Yale Medicine surgical pathologist and professor of pathology and medicine at Yale School of Medicine. Doctor, thank you so much for your time today. Good morning.
Good morning. Great to be here.
It's great to have you, and this is so important for people to hear. What factors make stomach cancer particularly challenging to diagnose or even stage accurately?
Well, it's a great question. So, stomach cancer is usually first suspected when someone is undergoing what's called upper endoscopy by a gastroenterologist who is looking through a tube with a camera at the stomach. And if they see an abnormality on the surface, it can be challenging to know just by looking if these changes are, inflammation or benign ulcer or are due to cancer. Or if it is a cancer, how deeply it invades into the wall. But GI docs are truly expert, fortunately, at sorting this out by taking multiple biopsies and, if needed, applying a technique called endoscopic ultrasound to get to the right answers.
All right, so which types of pancreatic lesions are we talking about that are most frequently misdiagnosed or perhaps misunderstood?
Yeah, and this is another tough one. So just by way of background, if we're considering tumors of the pancreas, the most challenging part actually about detecting them is simply knowing they're there, because many growths don't lead to symptoms that would bring you to the doctor until they get to a certain size. So first we start off with radiology tests like MRI and CT scans, and these are very good at showing outlines and locations of growth and distinguishing, say, benign cysts from a solid tumor. Sometimes, back to your question, inflammation that's called pancreatitis can mimic a tumor, and that is a challenge. So biopsies will be needed to distinguish those two things.
Wow, well, it's good to know that that is so frequently misunderstood. At least it's on people's radar. And what questions do you wish patients or at least caregivers asked more often about their pathology results?
So, of course, this is my favorite topic as a pathologist, and I think there are two questions. Does this diagnosis fit the overall clinical picture? Does it make sense? And second, is it an unusual or rare diagnosis? If so, it's always a good idea to have that diagnosis confirmed by a pathologist who's a specialist in that disease. And this may not be widely known, but pathologists subspecialize in every body part, basically, just like there are gastroenterologists, cardiologists, and kidney doctors. And these specialist pathologists are usually found in larger hospitals and academic medical centers.
You're so right. You have to be your own advocate and ask those very important questions. Dr. Marie Robert, thank you so much for your time today. Really appreciate it.